Here, I'm going to talk about some lab values. First one is the cholesterol. Cholesterol supposed to less than 200 milligram per DL. If the cholesterol level more than 200, it can cause atherosclerotic change or different kind of heart disease. High density lipoprotein is called good cholesterol. The good cholesterol is supposed to be 40 to 65 milligram per DL. So if the HDL less than 40, it is bad because it is good cholesterol. Why it is good? Because they carry out the bad cholesterol from heart to the peripheral organ and save your heart. So if you do exercise, your HDL level will go up. If you drink little bit wine, your cholesterol, HDL cholesterol will be go high, and it is good for your heart. But LDL, low density lipoprotein, is bad cholesterol for your body. Why they are bad? Because they bring bad cholesterol from periphery to the heart, and they causes atherosclerosis or arteriosclerosis and lead to the heart disease. And LDL supposed to less than 200 milligram per DL. Creatinine. Creatinine and BUN, this is the kidney marker. If kidney does not work well, creatinine supposed to increase more than 1.2. So my kidney is okay or not okay, or any chronic kidney disease, kidney test we can do, means creatinine level check and blood urea nitrogen. Kidney test from muscle that has been metabolized to waste product. Particularly creatinine comes from muscle and passing through the kidney. The normal range of creatinine level 0.6 to 1.2 milligram per DL. So if the creatinine level is more than 1.2, so high creatinine indicate or signal renal failure. And BUN, blood urea nitrogen, also the waste product. My kidney is working well or not, my liver is working well or not, it indicates blood urea nitrogen level. Or kidney function test, liver function test is the blood urea nitrogen. So normally it is 10 to 31 milligram per day. Some book wrote 7 to 22 milligram. And here, so the BUN, the test measure the level of urea in blood. Urea is a waste product that comes from protein, and it's what is left over. Urea is made in the liver, but then it's the kidney job to get rid of it through the urine. So it is a waste product made by liver, but kidney supposed to expel out from the body. So if the blood urea nitrogen more than 22, or some book wrote 8 to 25 milligram per DL. If it is more than 25, it means my kidney have a problem. And unit is microgram per DL, deciliter. What else? Next is glucose. The glucose level supposed to 60 to 110 milligram per dl. And some book said the glucose level supposed to 160 to 120 milligram per dl. But whatever it is, we get confirmation by hemoglobin A1C. And hemoglobin A1C is supposed to 4 to 6%. So serum glucose is the amount of sugar in the blood. Most of our sugar comes from carbohydrate. If my pancreas does not work well, or if insulin deficiency, or my tissue does not use the insulin, my blood sugar level go up more than 110 milligram per dl, and patient is diabetic. The next one here, the potassium. Let me explain the sodium first. Sodium is 135 to 145 millimole per liter. 130, 145 milli equivalent per liter, or so sodium maintain the fluid level or muscle, and it is important for muscle function, or it is important for nerve function. If sodium level is less than 135, we call hyponatremia. If it is more than 145, it is called hypernatremia. Next is potassium. It is supposed to 3.5 to 5.0. In some books say 3.5 to 5.5 milli equivalent per liter, or 5.0. So potassium is the important minerals and electrolyte. They carry carrier and electric. They make the balance of electrical charge. They are important for our tissue function. And next one here is triglyceride. Triglyceride, if you read with cholesterol, it should be easy to remember. TZ supposed to be less than 150 milligram per dl. Cholesterol supposed to less than 200. And next here, calcium. Calcium is 8.5 to 10. Calcium is a minerals. It is important component in our bones and teeth development. If the calcium less than 8.5, we call hypocalcemia, and patient develop tetany. Or if it is more than 10, it is hypercalcemia. Both are bad. Next is magnesium. It is 1.6 to 2.6. Some books say 1.3 to 2.1. So magnesium is the important for our nerves or muscle function. And particularly, muscle helps to neutralize the acid in the stomach. And also, some of the medication contain magnesium, like milk of magnesia. Next one is chloride. Chloride is supposed to be 95 to 105 milli equivalent per liter. So electrolyte is chloride is an electrolyte, keeps the fluid balance, and particularly in and out of the cells, it is important. We get most of the chloride from sodium chloride. what we ate, and it is digested in the intestine. So there are some few normal values of uh, electrolyte and or we can say blood chemistry.